Hey guys, welcome back to the podcast. I'm Amanda,
I'm Laura.
I'm Kendra.
and today we are so excited because we are honored to have a very important guest joining us today. Dr. Stef Simmons is a board-certified emergency physician. She's a certified coach, and she happens to serve as the Chief Medical Officer of the Lorna Breen Heroes Foundation. Dr. Simmons is a national thought leader in healthcare worker well-being. She was the primary NIOSH advisor, that's National Institute for Occupational Safety and Health, for the Impact Wellbeing Guide for healthcare leaders. She leads multi-state programs to improve the operational environment of healthcare and remove barriers to mental health support. This is such important work. Thank you so much for joining us, Dr. Simmons.
It's my pleasure to be here. Thank you.
Yes, we are so excited to have you. And just to get things rolling, if you could, go into the Lorna Breen Heroes Foundation and tell us who Dr. Lorna Breen was.
Sure. So Dr. Lorna Breen was an emergency physician practicing at New York Presbyterian Hospital in Manhattan. She was faculty at Columbia and ran the department at NYP. She came back to New York from vacation with her sister and brother-in-law and their kids, where she was snowboarding, which is something she loved to do, to help lead her department in the first wave of the pandemic. And, I think we can all remember the sights and sounds and times of those first days and weeks in New York. And that's what she went back to. And she did. She led her department. She cared for patients. She worked long hours without rest, day after day after day. And, she was fielding calls at home as, supplies ran out and people needed time away. She got sick. So she got COVID herself. And like many people did, she went back as soon as she was cleared to go back. I think it was 24 hours without a fever at that point, right? And when she returned back, she couldn't keep up. She was exhausted. All systems were not back online yet. And she was terrified that if she couldn't keep up, if she was seen to not be able to keep up, that she was going to be failing her team. And so she kept pushing. And she finally got to the point where she really couldn't even get out of her chair in her apartment. Her sister called her. They evacuated her out of New York with friends from medical school and residency, driving her down to Virginia, which is where she grew up and where her family was. And she was hospitalized. She had her first ever psychiatric hospitalization because physically there wasn't anything, and using air quotes here, wrong with her, right? Other than exhaustion and post-COVID and all of the other things that were going on. And she was discharged home. And when she was discharged home, she expressed to her family that now she had received mental health care. She was terrified she wasn't going to be able to be a leader. She wasn't getting to be able to be credentialed at her hospital, licensed in her state. And soon after that conversation, she died. She died by suicide. And 12 hours after that, the New York Times published her story against the family's wishes at that time. And there was an outpouring of first dozens and then hundreds of, and now thousands of stories from healthcare workers across the country saying Lorna was not alone. Many people from all walks of life in healthcare, emergency medicine, yes, certainly, physicians, yes, but also nurses and pharmacists and techs and paramedics had been experiencing burnout, not just during the pandemic, but for years beforehand, that they'd experienced mental health crises and also this fear and stigma around seeking care and getting care. And so Lorna's sister and brother-in-law, they wanted to do something to honor Dr. Lorna Breen, yes, but also the stories and the need that they heard from healthcare workers across the country. And so they started the Dr. Lorna Breen Heroes Foundation. And the foundation really has two twin aims, and it's to help prevent healthcare worker suicide, but also to address the causes, the drivers of burnout, so that healthcare workers can find joy in their work.
That's incredible. And just thinking back to that time when somehow we were glorified as heroes, but probably even more vulnerable at that time than even the patients we were taking care of. I mean, just to think of the kind of paradoxical effect of just that incredible time, but also just a real turning point, I think, for the way the medical or the healthcare profession was seen. And then, trying to climb out of a pandemic, but then also the landscape of our profession was never the same too. So
Yeah.
just really interesting.
I mean, it rapidly changed from people banging on pots and pans and a sign on everybody's front yard saying thank you, right, to arguments about vaccination and increasing and escalating healthcare related violence and incivility. So, in addition to the stressors of working during an infectious pandemic with a lot of unknowns in terms of how to protect yourself, your family, in addition to the change in staffing, going from walking into an emergency department and knowing everyone there, right? Their kids, their stories, how they're going to respond to you, how you work together as a team, to walking in and having most of your staff be travelers or new or a combination of that. I mean, it really radically changed the experience of providing care. So there's all of that. And then the change in the way that healthcare is delivered in the last 5 years has been just an acceleration of the pace of change in healthcare in general. And then the societal changes, the unrest and the incivility. And I would say in a lot of ways, the loss of respect for expertise. And so as healthcare workers, that has been just a lot of change, and a lot of it not very great change. And so, really the foundation we're doing our best to educate and to meet some of these needs along the way.
Yeah, that's fantastic. So tell us a little bit about your own experiences leading to why you do what you do now, how it impacted you. What was your why?
What is my why? Well, I have a couple of whys, so I'll try to do the Cliff's Notes version rather than the long shaggy dog story. I don't want to be like the back pain patient, right? Who's like, well, back in 1976, the first time my back hurt, I had postpartum depression in residency, and I feel like I could have gotten better a lot faster if I had felt like it was safe to get care. And I'll be the first to tell you, I didn't have a particularly toxic residency. I had mentors I could talk to. I had some excellent faculty that I worked with. It was more like the overall culture of medicine. It's not okay to need care, right? You got to be tough, suck it up, buttercup, sleep when you're dead, et cetera, et cetera. I mean, we could, I'll go through probably our five phrases, but it made for a little rockier start to my career and to the end of my residency that I wanted. And I was very interested in the social science aspects of medicine, how we relate together in teams, how we relate to our patients, and how we relate to ourselves. So I actually dropped out of an RWJ fellowship because of my postpartum depression and started a job at the community location of my residency at the U of St. Joe's residency program. So I got a job at St. Joe's with a medical group. And I told them that I was interested in working, but I also wanted to figure out what my hobby at work was going to be. So I wanted to work 10 shifts a month and go to every meeting for the first year. I also had 2 little kids. So that's what I did. And I loved the culture of safety work. I ended up being the culture of safety lead for my hospital. And I was asked to be the quality and safety manager for the medical group. And I said, gosh, that's not really the direction I think I want to go, because what I really like about the culture of safety part is the culture part and less the safety part.
Good for you having clarity on that.
That was clear to me. Of all the things that were so unclear at that stage of my life, that was clear to me. And I said, but nobody's looking after patient or clinician experience. So can I have that job? And they said, well, we don't have that job, but why don't you write a job description for it? So again, a wonderful CMO of that group who gave me that opportunity. Shout out to Dr. Rodney Smith, and a wonderful president of the board and president of the group who gave me the opportunity to write a job description for what that job would look like. So I became the medical director of patient and clinician experience, started coaching, because it turns out when someone's having a patient experience complaint, it is usually a professional well-being issue, right? You can't give what you don't have. And so as I would talk to people about their patient experience work, it turns out it just ended up being a lot of coaching people and trying to help them and figure out what they need, and then running interference for them with the group in the hospital and all that while they had a chance to get stuff together. So I did that. It was some leadership development, 360-degree evaluations, all that I was kind of running for that organization. And as happened in a lot of places in EM, right, it was a acquisition, consolidation, acquisition situation. And I was part of each of those acquisitions. So I ended up running the patient and clinician experience group as a VP at a large national medical group for 26,000 clinicians. And that's what I was doing when the pandemic started. And those clinicians were largely EM, HM, anesthesia critical care. So it was all of a sudden there was 26,000 people who needed a lot of support. And I felt that very strongly. So we had a coaching program that we had developed for peer coaching for physicians, and we're litigation peer support. We had started to think about rolling out a well-being champion program where at each site there would be somebody to go to who knew what the resources were, who could identify what some of the pain points of practice were and make a difference in those by escalating them up, and could provide some peer support, particularly around litigation. And we had to pivot all of that because of the pandemic. So that's what I was doing when the Dr. Lorna Breen Heroes Foundation started. And one of my coaches was actually getting his MBA at Darden School of Business, which is where one of the co-founders, Corey Feist, teaches. And he said, you need to talk to this guy because he talks about well-being like you talk about well-being. And so I cold called him on LinkedIn, and we talked for 2 hours, and I asked to be of service. They put me on the board. And last year I became the chief medical officer. So it's been almost 2 years now that I've been doing this work with this foundation. But really, since residency, I've been doing this work.
I love that. I love that so much. So tell us, because it's hard to know unless you're involved in all of this stuff for the average listener out there, will you tell us about the national scope of work around burnout?
Sure. And I think it's really important for people to know there is a lot going on, and there are some positive changes happening. So one of the things that happened early on, Senator Tim Kaine from Virginia called the Feist family, Lorna's sister and brother-in-law, and expressed his condolences because they are from Virginia and in his district and in his area. And so he called and he said, we need to be doing something about the mental health of the healthcare workforce. And so Corey and Jennifer started to work with their office to think about what that would look like. And eventually, through the leadership of that office, but also in a bipartisan, bicameral way, there was the passage of the Dr. Lorna Breen Healthcare Provider Protection Act, which was funded through the American Rescue Act and was a 3-year legislation. It programs in 45 different institutions and projects to offer support for healthcare workers and also start to change systems that are broken for healthcare workers. So that was called the Workplace Change Collaborative. And the final sort of data and study component of that is just coming out and should be able to be replicated and applied other places. The American Hospital Association put together a healthcare worker suicide prevention guide, which is really good. And NIOSH received money through the Total Worker Health Program for the Impact Wellbeing campaign. And that was meant to be an awareness campaign for healthcare workers and healthcare leaders around burnout. And most people were already aware when we started digging in and doing the work. And people said what they really wanted was they wanted solutions that hospitals and health systems could take on. So NIOSH worked together with the Dr. Lorna Breen Heroes Foundation to put together a 6-step guide. Here are 6 things that if you're not doing them already in your hospital or health system, you can do that will help make things better. One of them is to make sure that you're removing stigmatizing and invasive language about mental health from your credentialing application. Okay. And so that's also been a big part of the foundation's work outside of the Impact Wellbeing Guide. So you had the passage of the Dr. Lorna Breen Healthcare Provider Protection Act with those 3 major programs sort of coming out of that. And then you also have the work of the AMA, the ANA, the AHA, we call that the A-team. We have a group that comes together every other week called the Tier 1 Collaborator Group. It includes the A-team and also representatives from different parts of medicine coming together, sharing what they are doing in their own organizations. Because we always say there's more silos in healthcare than in Iowa. So trying to break down some of those silos so people can work together and share their work. In the meantime, the Federation of State Medical Boards and the AMA have put together sort of like a statement about removing that invasive and stigmatizing language from state medical boards as well. And before the pandemic, there was like 14 or 15 states that had taken that language out. And today, with the partnership really across the country of a lot of different organizations, we're up to 29, okay. In just 4 years of change. That's fast change when it comes to sort of regulatory bodies and in medicine and all that. So we're hoping that in another year or two, we'll be able to celebrate 52, because we also want to get Puerto Rico, DC in there as well. And the nurses are starting on this, by the way, too, the pharmacists and the dentists. So one of the things we've been doing at the foundation is publishing a map that it points out where those changes have happened, both at the state licensing level and also the hospital credentialing level. And for those organizations that make the change, and we can review their applications, review their peer reference forms, because sometimes those are the worst. And if they change them all, they get them into compliance with best practice or consistency with best practice, we'll give them a badge. And it's called the Champions Challenge Badge. And it's not just designed to be like a gold star. Everybody likes a gold star, but that's not the point. The point is to communicate to the healthcare workforce, hey, we took these questions out. You're not going to be asked here about your mental health care. And so to help remove one of those barriers of institutionalized stigma. So that's some of the work that's going on. We're working to reauthorize the Dr. Lorna Breen Healthcare Provider Protection Act. So it was already pretty long, but now it's the Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act. And we're kind of like one step away from getting that reauthorized. So looking forward to 5 more years of projects and programs to address healthcare worker well-being, this time with a focus on reducing administrative burden. Dun, dun, dun.
Ooh.
So something
that would be amazing.
That would be amazing.
That would be amazing. Yes. Okay. Well, we heard about the 29 states now where you don't have to disclose that you're under the care. What are some of the other impacts that the foundation has made?
Great. So we just announced the 29 states. Also, 375 hospitals have removed these questions from their credentialing application. We worked to get the initial Dr. Lorna Breen Healthcare Provider Protection Act passed, and we're working now on the reauthorization. We've partnered with NIOSH and the Impact Wellbeing Guide and worked to really get that out into the hands of hospitals and health systems through a webinar series, and also through basically advocacy at the hospital and health system level. We are working through advocacy again at the federal level, but also at the state level, because it turns out you can change these questions on licensing exams 2 ways. The board can change them because the board decides to change them, or you can pass a law saying that the boards aren't allowed to ask these questions. And that change is happening both ways. And frankly, sometimes, there are some states that have 62 different boards. For licensed healthcare workers. And there are some states that have 1. So depending on which way you do it, it may make more sense to do it one way or the other. We also are working to advance collaboration. So I talked about the Tier 1 collaborators. We also have an ambassador program where we have over 150 healthcare worker and families who have are the survivors of a healthcare worker's suicide, right? Who have come together to advance this work and to move it forward. We have a medical student coalition that self-organized, is like the most motivated, amazing group of medical students. And they self-organize a coalition, and they are doing work to get hospitals and health systems to change their questions, yes, but also to share within the group what their schools do, so that they can then advocate for, if their school doesn't do something that another school does and people find helpful, they can change. So that's our collaboration work. And then we're really trying to accelerate the pace of change. So you mentioned in your intro the statewide collaboratives. That's called All In Caring for Caregivers. So its development occurred with our All In collaborator group. And what we're doing is we're forming learning communities within states. The first state was Virginia. And we take the entire state through a process of change. And that starts with changing the licensing application. And in Virginia, there was a law passed. Can't ask invasive or stigmatizing language on the licensing application of any licensed healthcare worker. So that was 500,000 licensed healthcare workers. And then we started a challenge. We said, okay, hospitals, the state did their thing. Now you change your credentialing application and remove the stigmatizing language from the credentialing application. In the first 10 months, 75% of the hospitals in the state changed their credentialing application. So we published that in the American Journal of Public Health. That actually, after that publication, 2 of the hospitals in the state belong to the largest private healthcare system, HCA. And they wanted to change their applications, but every single HCA hospital is like internally credentialed through HCA because they're so big, they have their own process. And they changed their internal credentialing application to eliminate questions about licensing or about history of mental health diagnosis or treatment. So that was part of the impact in Virginia, is that all of their hundreds of hospitals changed their questions. The next sort of phase of work at the state level is education for hospital leaders. So this is not a resiliency or a wellness module for a healthcare worker. This is here are the drivers of burnout. Here's how you address them. And here's the leadership systems you need in place to get this work done at your hospital. Training for the operational and the clinical C-suite. We got 85 C-suite leaders in Virginia to go through that training program. And we are starting on phase 3, which is to operationalize well-being. And in Virginia, they chose to focus on EHR optimization and really making the EHR work better for the healthcare workforce. And there are 12 systems, so over 100 hospitals in Virginia going through this process right now, working on a project to make the EHR work better for their healthcare workforce. They're using something called the Well Ops curriculum. And so you go through that curriculum and it makes sure that you're not you're not letting the tail wag the dog, right? Sometimes we have a quality and safety project, we have a quality improvement project, and all of a sudden you lose sight of the impact on the work of the workforce that the workforce is feeling. And so this keeps the workforce centered in the work to make sure that the project is actually going to change their experience. So that's where we are in Virginia. North Carolina has signed up. We've got the coalition started in New Jersey, and we actually have 4 other states that are saying, hey, we'd like to take this journey with you. And we work with the Medical Society, the Hospital Association, the Nursing Association. Those are sort of like the non-negotiables. And then anyone else in the state who wants to come in, because again, it's all in caring for caregivers. So when we say all in, we mean it.
So reducing the administrative burden obviously is huge. The Medscape surveys always say that that's like a leading cause of burnout. What other things can hospitals do or systems do that make a big impact?
Yeah. So thank you for asking. The first is really to know what's already happening. Like, where are the bright spots? Because there are bright spots. Like there's that one unit that does something really cool and everybody loves working there, right? There's that one person who like took it upon themselves to be the well-being ambassador to their unit and has some wonderful best practice. You don't want to lose those. So the first thing is find out what works and don't kill it, right?
Nice.
Because sometimes when there's like a big new program that comes in, that's what happens. So it's find out what works, don't kill it, and then grow it, right? So grow it. The second thing is to listen to people. So get together a team of folks who are going to advise on the work. There needs to be an executive sponsor. So you need to have a leader who is going to lead this work, who is going to remove the barriers for the work, who's going to help to find the funding, et cetera. And then really a representative interdisciplinary team. So a lot of times physician well-being is separated from the rest of the team. We don't work separate from the rest of our team. And if the person I'm working with is like in crisis, I'm in crisis. Like our whole team's in crisis. So we need an interdisciplinary approach to this. So really getting that sort of committee together, having leadership. That leadership, it can be a chief well-being officer, but it can also be like tripartite, CMO, CNO, CHRO sort of situation, or it can be a non-executive member. It's just, as you have more complex systems, it needs to be more resourced. Then you need to remove the barriers to receiving mental health care in your organization. So credentialing change. Then you need to be really thoughtful about communication. So that means you communicate about what you've done so far so that you're not just saying, hey, we're focusing on well-being and these are all the things we're going to do. You say, hey, we're focusing on well-being. Here are the things we've done so far, right? And here's our plan, right? So that sort of communication, we'd love for people to communicate the badge as part of that. But also think about two-way communication. So how are you listening? whether that's leadership rounding, whether that's an app like some hospitals are doing where people can sort of share those pebbles in their shoe that are making the mountain really hard to climb that day, right? Two-way communication. Next, it's just get some practice, like including the impact of the work on the workforce. So add in a workforce well-being KPI to a quality improvement project. It uses the infrastructure that's already at the hospital, the dozens of projects that are already ongoing, and it shifts them into a healthcare workforce well-being lens. And then last is think about how you're going to measure professional well-being. There are a lot of great ways to measure it out there. How you're going to institute peer support or enhanced mental health resources, right? That can be coaching, that can be enhanced psychology or psychiatric availability for your site. That can be trained peer support program. There are a couple of really good ones, but you can't just say the EAP is enough. It's not. And then also to look at how are you going to then take the learning that you had around that well-being KPI in your quality improvement project and make all of your projects include a measure of the impact of the work on the workforce. So what I just actually brought you through were the 6 steps in the impact well-being guide, because you asked what hospitals could do. That's what that's all about.
Yeah.
And so those are kind of the first 6 bites of the elephant, right? It can feel like when you wake up on Thursday morning and you're like, I want to address healthcare worker well-being, that you have to fix the whole US healthcare system, which is daunting. That's the elephant.
Yeah.
And when you're going to eat an elephant, you need to know where to start. Like, here are the first 6 bites, and here are the people you need to come along with you to help you, because it's going to be too big of a job to do by yourself.
So amazing. And I would like to say that I see another field of impact that your foundation has made is just bringing awareness to the fact that this is a major, major problem among healthcare providers. And it's not some brokenness in them. It is, like you said, the system actually is geared towards unwellness for us. Even just catching COVID increases your risk for major depressive disorder, let alone all the secondary traumatic stress and sleep deprivation that we endure. I just thank you so much for all that you're doing to bring awareness to it.
Well, you're absolutely right, Laura. There's like so many factors that are conspiring against who are arguably the most resilient people in the workforce, bar none, which is our healthcare workforce colleagues, right? And there's a chief wellness officer. She's at MUSC now. Her name's Heather Farley. I heard this first from her. She said, we can't just focus on building stronger canaries. We need to fix the coal mine.
Amen.
So
Amen.
It isn't about fixing individuals. This is about fixing systems and providing individuals the support they need in the meantime.
Yes, absolutely. We, obviously we're very passionate about coaching as an intervention for physicians and healthcare workers. And we're seeing research bear it out as an effective strategy to improve symptoms of burnout and physician well-being. What many people may not be aware, in fact, we say all the time, we think every medical student should have a coach from the beginning, because it is such an incredibly demanding career and training path. And what people may not be aware of is that there are groups who offer not only, so most EAPs will have connection to a therapist or even to psychiatry, but other physicians who do this professionally are available. We have a program. We work with several hospitals that they provide it for their healthcare workers who want it. Obviously it's not going to be beneficial if you don't want it, but there are several other coaching groups who do the same. And we'll link some of those in our show notes. But if your hospital isn't providing you some kind of resource, this is something you can take to them and say that this actually is going to improve so much about what's happening in this hospital. It will make it more likely for your providers to feel good and improve patient outcomes and improve, employee retention. And the whole culture will shift from just, supporting the people who are kind of holding it up. So talk to your administrators about getting that kind of support for your people there.
For sure. And coaching, I think it's also worth mentioning, like, coaching is not psychiatric care. And if somebody has, major depressive disorder, if somebody's having suicidal ideation, like it may be a yes and for coaching.
Yes.
It's like, right. But it shouldn't stop at coaching. And that's one of the reasons what we're really going after, like removing the barriers to mental health care as well. And in the meantime, coaching is fantastic. So, I'm a coach. I've led a team of coaches. You're preaching definitely to the choir for me. But one of the major benefits, I think, is that you don't have to orient the person that you're talking to the reality of what you face when you walk in to work,
Right.
in the same way that you may have to with a non-physician helper. And so that creates a shorthand. And it also creates a huge challenge for the coach not to assume that their experience is the same as the other person's experience. So it was kind of like the easiest part about coaching other physicians, and also the hardest part, the most challenging part for me.
Yeah, absolutely. So, and yes, and we have many clients who coach and have a therapist and have a psychiatrist. And if you need them all, then you need them all. And that it just shows your own maturity and wisdom to access those resources rather than try to pretend you don't. So, all right, question. This is an election year. Does that have any impact on funding for the Dr. Lorna Breen what is it? Healthcare Provider Protection Act?
You got it. It's like a little bit of word salad, but it gets the point across. It's a great question. So right now we are out of committee in the House and the Senate. We are waiting for a full vote on the Reauthorization Act. The Reauthorization Act is a bipartisan sponsored act. It is bipartisan and bicameral. And the first act was passed that way, and this act will be passed that way too. So in some ways, the biggest impact of the election may be the fact that it just sucks a lot of the oxygen out of the room in terms of getting things done. But things still happen in Congress and in the Senate during the election time. So we're hoping that this will get passed in the next couple of months before the end of the year. If not, we're hoping it will be a continuing resolution and get passed in continuing resolution. And then it will need to be funded. And so the passage of the act and the funding of the act are actually separate. And each year we'll need to advocate for the funding of the act. And different people may have different opinions on what that looks like. And so we will see. But we've always had, Republican and Democratic co-sponsors, and really the provision of a healthy safety net nationally isn't a partisan issue. Everybody wants their constituents to be able to receive care. Almost everybody has a hospital in their district and is hearing from their constituents that this is a major issue. And so we just want to make life better for all Americans.
I feel great hearing that there is such bipartisan support, because hopefully they recognize that we do kind of help stabilize society and make other things possible. So we're kind of important.
And super duper important. And like any single one of us right now speaking, but certainly anyone listening and any of their family members. And that also goes for the members of Congress. Like anybody can be a patient tomorrow. Anybody can be a patient 5 minutes from now. Let's be real for real. So like we also, need to look after ourselves and our families and our communities as well.
Yeah. Well, Stef, thank you so much for all the incredible work you're doing and have been doing for, sounds like, a long, long time. There are probably many of us who have been benefiting from your work who don't know whom to thank. Let us say thank you on behalf of them, and just keep up the great work. We appreciate you so much. And how would you, if somebody wanted to contact you, how would they do that?
That's great. So first of all, I always tell my coaching clients, when somebody says thank you, make sure you take a moment to really receive that and let it sink in. So I'm just going to take a moment and say, thank you. Thank you. It means a lot that you say that. It is an effort that there is like an army of people who care about this issue working on. And so I'm really proud to be part of that effort. anyone who wants to get in touch with me can get in touch with me via email at stephanie@drbreenheroes.org and also through our website. And I'd also like to point out that on our website and in the show notes, there are all sorts of ways that you can get involved. So whether that's writing your representative to encourage them to reauthorize and fund the act, whether it's writing your state medical board if you are not in a state that has already changed and asking them to change. There are links for both of those things on the website. If you're interested in changing the credentialing application at the hospital you work in, we have a toolkit on how to get that done. And the Impact Wellbeing Guide is out there too. If your hospital is wanting to get started and doesn't quite know where to start, there's a resource for that.
We'll even have links where you can donate too, because that's something that we can do also, right? Can we donate personally to the Lorna Breen?
Yes, thank you. So there's absolutely, we are a foundation. We are funded through philanthropy. A lot of people think that the Dr. Lorna Breen Healthcare Provider Protection Act funds the Dr. Lorna Breen Heroes Foundation. It does not. It funds all of these other projects and programs. And so anyone who would like to support this work, we would really appreciate the support and help us to move our mission and really the protection of all of our healthcare workers forward.
Wonderful. Do you have any closing thoughts?
Well, I know a lot of people who are listening to this are probably our healthcare workers. And I think it's important for people to hear that just because you are a caregiver doesn't mean that you can't be a care receiver and still be the same badass clinician that you were before. So in fact, you are going to be better and stronger and more whole as a human and as a clinician and in all the roles of your life, whether that's as a parent or as a partner or as a friend, because you're integrating the experiences of caring for people in their most critical traumatic moments into your whole self, as opposed to just throwing that in the backpack and letting it weigh you down. It weighs down your actions, it weighs down your decisions. And we all need to make sure that we're taking care of ourselves as well. How's that for a parting thought?
Yes, well
it.
said. Yep, well said. Thank you so much, Steph. What an amazing time we've had with you. And we honor you for using your own experience, your testimony, what you went through, really to just ignite that passion. And no doubt your story resonates with any of our listeners, but also just people that have been there, done that. And so thank you for being their voice, because they don't always have this kind of platform and they're not, doing the work on the large scale that you get to be a part of, but that they feel validated and just being heard that someone did go through that. And so you're representing all of them too. So thank you so much. And thank you to our listeners for listening today. We will say it once and every time. Leave us a review. Scroll down, leave us a review. Give us those 5 stars because it helps other doctors find us. And we believe messages like we heard today, we want our ripple to be even bigger. So it helps us move us up on the list. So, and we're going to tell you that we have a new free video, how to crush physician burnout for good without cutting back hours, quitting medicine, or sucking it up in silence. So scroll down to the show notes. You'll find that link and check it out today. So until next time, you are whole. You are a gift to medicine, and the work you do matters.